Good morning, and thank you for joining us for SBB Live. I am your host, Amanda Barton, and the publisher of Seniors Blue Book, and I'm honored today to be joined by vein specialist ARNP, Jill Tanner. How are you doing this morning?
Hi, how are you?
I'm great, holding up as well as can be expected in these uncertain times.
I know, absolutely. Hopefully we'll have some normalcy soon, but overall doing well.
Yes, absolutely. I hope so too. So we're here today to talk about vein disease and some specifics. Can you tell us what a DVT is?
Absolutely. So a DVT, we're also called a deep vein thrombosis, that's just a quick way to say it, is when a blood clot forms in the deep veins of our lower extremities. So this is common in the pelvis or the legs.
Okay, perfect. You want to go over some signs and symptoms that are associated with that?
Absolutely. So signs or symptoms really vary from person to person, and they can range from being mild to being more severe. So the most common things, especially that we see in our practice, is leg swelling. It's usually a newer onset of swelling. Maybe it happened over the past few weeks or few days. They may have pain with walking. They may even have pain to the touch of the leg, or it may feel hot. And they can also have redness or a tightness, and this is usually more common in the calf. More severe symptoms that patients can have is chest pain, dizziness, shortness of breath, and that's where we worry that maybe a blood clot traveled to the lungs, which is something called a pulmonary embolism, which can be life-threatening and really needs to be addressed right away.
Very life-threatening, I know.
Right.
Yeah. Now, how is a DVT diagnosed?
Yep, so a DVT is diagnosed most commonly by doing an ultrasound. You can do a CAT scan or an MRI, but typically this is done with an ultrasound, and this is how we do it in our office, where we scan the pelvis and then also the lower legs. In our practice, we obviously handle vein disease, so our sonographers or ultrasound techs are, if there's a clot, they're going to find it. So everyone does it by a systematic approach. If there is a blood clot, or if a patient feels like they have a blood clot, they should contact their primary care provider. We offer something called a rule out DVT service at our office. So if a patient thinks they have a blood clot, their provider can actually send over an authorization for us to do an ultrasound right then and there that day, and we can go ahead and give them the results. If it's positive, we'll obviously contact the referring provider, and then we can also contact the primary doctor, and we can start a medication management with them or a plan. If it's negative, obviously that's great news, but we would still let the referring provider know as well.
So if it is positive, how is it treated exactly?
Sure. So typically with blood clots, obviously depending on where they are or how severe, typically are treated with something called an anticoagulant or a blood thinner. So the ones that are most common are going to be things like Xarelto or Eliquis that patients may hear of. Sometimes we can treat with aspirin, but most time I would have to say we treat with a blood thinner. If we do find a positive blood clot, again, we would contact the primary care provider to see what sort of medication management they would want to go ahead and start the patient on. And typically we have samples in the office where we can at least get patients on some medication while they're awaiting getting to their primary care provider for medication management. And really it depends on the length of treatment. It really depends on where the clot is. I'd say most people have to be on a blood thinner for 3 to 6 months typically. If they've had previous blood clots before, that may be something where they might have to be on lifelong, and we might recommend them seeing a hematologist or someone who specializes in blood disorders to find out why they're happening.
Okay. And you mentioned blood clots a few times. Can varicose veins put someone at risk for developing a blood clot?
Sure. So first I'll just start with some of the risks of a blood clot. One is as we get older. 2 is if we have a clotting disorder or if we have a family history of a clotting disorder. A common one that we see is someone who may have something called factor V Leiden. And these are things that really should be addressed with a hematologist. If we're sitting for long periods of time, this is also really common, especially with traveling. We see patients who come in after a long flight, or if they've been sitting in the car for a long period of time. We obviously saw a lot after Hurricane Irma, just people sitting in the car trying to get out of Florida. If you've had any previous surgery, so the most common ones are probably going to be more of your orthopedic surgeries, such as knee replacements or hip replacements. We're just not as mobile afterwards, so we're more prone to getting a blood clot. Also, if we've had any sort of injury or trauma, if we're on any sort of hormone replacements. And then vein disease. Vein disease is basically when the valves within the veins are not working properly. They're staying open longer than they should, and they're allowing blood to leak back. And when blood pools in the lower legs, it sort of becomes stale per se, and it may lead to a blood clot. So when you ask about varicose veins, one of the risk factors is venous disease, and a common sign of venous disease are varicose veins. So there is some correlation where we think the pooling of this blood or the dilation of the veins can lead to a blood clot.
Yeah, that was going to be my next question. Do you actually have to have varicose veins to have Venere's disease?
And that's a great question. So you do not have to have varicose veins to have venous disease. A lot of times people think that their signs may not be vein related because they don't see these large, bulgy varicose veins. So you can have other symptoms like heaviness or achiness. You can have restless legs or leg cramps. And typically those signs and symptoms are worse at the end of the day and typically improve with walking or moving around or wearing compression hose.
Perfect. And what are some of the other signs of vein disease?
Sure. So like we said, there are things that we can't see, and then there are things that we can see. So the most common are going to be your varicose veins, spider veins, which are those small purple veins that are typically more cosmetic in nature. Also, we can also have discoloration. There's something called stasis dermatitis, and this forms when blood flows downwards and it pools, and the red blood cells, the iron in them, start to stain the skin. And why we worry about that is that's a precursor for possibly developing an ulcer. Vein disease can happen in one leg, it can happen in both legs, and those are typically the signs that you would see.
Awesome. And what can you do during this pandemic to promote good health for your veins? Because I know you mentioned like Hurricane Irma, you saw an increase. A lot of people are, not doing a whole lot right now. So talk to us about what we can do to keep our veins healthy.
Yeah, absolutely. So as we know with this pandemic, it's really changed our lifestyle. We're probably a little bit more sedentary. Maybe we're watching a little more Netflix, or if we're doing some computer work, maybe we're sitting at the computer longer or working. So it's really important to make sure that you get up and you walk around, try to move as much as possible. If you do have to do work and you're sitting at your computer, putting on a pair of compression socks, I've had to do it myself, pump the calves. Also exercise, obviously following the protocol of social distancing, but getting up and walking, riding your bike. If you have a pool at your house, obviously not using the community pool right now, but if you have a pool at the house, the pressure of the water acts like compression socks almost. It's a really great exercise to get in the pool and move around. At night when you are relaxing, putting up the feet, elevating the legs. So I think those are the things that are most important, is just keeping moving and, try not to be as sedentary during these times.
Fantastic. Well, thank you so much. I really appreciate you coming on today and answering these questions and joining us for